There are many things we encounter in life that make us uncomfortable, like seeing food stuck in someone's teeth. How much does this bother you? To tell or not to tell, that is the question, isn't it? Stare in discomfort or risk embarrassment by pointing it out. In either decision, you probably won't think much about that piece of food stuck in someone's teeth after the encounter's passed. Okay, what about this? Yes, I'm talking about that time Patricia totally violated the rules of pizza cutting. This monstrosity will probably stick with you at least until the next group study sesh, but it won't nag at the back of your brain while you're trying to study for a math test a year from now. Hopefully? Now, what about this? For an individual struggling with obsessive compulsive disorder, or OCD, something as simple as this would drive them nuts. Anxiety disorders, the category that OCD falls into, are the most common mental illnesses in the United States, as it affects 40 million adults, or 18.1% of the U.S. population, every year. Now, what exactly defines OCD? We all hear people say, "Oh, I'm so OCD," when in reality, they just like things a specific way. As we saw in the clip with Jack Nicholson, OCD is much more than simply keeping things tidy, and psychologists like to use a nifty tool called the DSM-5 to help distinguish actual cases of OCD. According to the DSM-5, the main criteria for OCD are obsessive thoughts that are persistent and unwanted, coupled with compulsive behaviors that the individual feels driven to do to ease their anxiety. In the United States, approximately 1% of the population is affected by OCD, totaling to about 2.2 million Americans. The important thing to know about OCD is it consists of a wide range of compulsions, with some being as small as having to fix uneven hoodie strings, to having to go out of your door 17 times before you can leave for work. And although anxiety disorders like OCD are highly treatable, only 36.9% of individuals with anxiety disorders ever receive treatment. This presentation will focus on OCD in children. Now, why is looking at pediatric OCD important? Well, when we see compulsive behaviors developing in childhood, it can be easier to break them with therapy than when the person is an adult. Although the average age of onset for OCD is 19, 25% of these cases occur by the age of 14, with a third of them showing symptoms in childhood. In psychology, we must always consider the constant battle between nature and nurture. Both factors are important at looking at developments of mental disorders, and there is significant evidence to support that biological and environmental factors influence OCD development. In order to create viable treatment options for OCD, considering both aspects is crucial. When looking at repetitive behaviors in children, over 70% of children with OCD follow these behaviors, such as sleeping with the same blanket every night, and were incapable of deviating from these behaviors without experiencing distress. It is supported in other studies that the encouragement of these repetitive behaviors from parents can lead to the development of OCD later in life, as these behaviors can become compulsions. Other researchers looked at cases of OCD to try and evaluate what environmental factors will cause them to maintain their OCD symptoms into adulthood. They found that OCD in childhood strongly predicted OCD in adulthood when they were not treated in childhood, suggesting that OCD symptoms carry on into adulthood based on how severe the OCD symptoms are in childhood. Now, when looking at studies pertaining to genetic aspects of OCD, a significant amount of evidence for a biological role in the development of OCD is revealed. We find that twin studies are the most beneficial when it comes to looking for biological connections to disorders, as they have almost identical genetic and environmental factors. In a study performed with sets of monozygotic and dizygotic twins, an inventory system measuring obsessional tendencies was performed to see any differences between them. It was estimated that heritability accounts for about half of obsessional traits in twins, with environment making up the other half. And yes, we can all agree that the Shining twins had many issues besides OCD. Other researchers found moderate genetic associations between specific symptoms of OCD. This implicates a significant genetic contribution to not just each symptom separately, but to OCD as a whole. This supports that there is a strong biological influence in the development of OCD, even though no specific gene or biological function has been directly linked to this disorder. Now that we have evaluated and developed an understanding of biological and environmental influences of OCD, we can look at treatment in a more efficient way. Currently, the main treatment method of OCD is cognitive behavioral therapy, or CBT. CBT helps the individual shift from negative to positive mindsets and behaviors using mental techniques developed in therapy sessions. Exposure Response Prevention Therapy, or ERP, is a form of CBT where the person is exposed to a situation based in their obsessions and are asked not to act on the compulsions that go with them. Researchers used ERP to see if it was beneficial when dealing with pediatric OCD. Most children in the ERP condition showed a positive response to the treatment and displayed no symptoms in the following months. Another study compared CBT to relaxation therapy, or RT. RT uses meditation to relax the body and still the mind from obsessions. It was seen that children in the CBT condition showed more significant improvement than those in the RT condition. The researchers concluded that using CBT was superior to using RT in reducing pediatric OCD symptoms. Another experiment evaluated if CBT was effective in treating certain symptoms of OCD. Most participants were responsive to CBT treatment despite differing symptoms, supporting that CBT works for treating OCD. The studies discussed about treatment options show that there are options besides CBT, but CBT has been shown time and time again to be most effective in treating OCD. In conclusion, it cannot be said whether nature or nurture are more influential in the development of OCD, but both aspects are supported as being crucial in developing effective treatment options. Thank you to Dr. Danik for her help with this research and to Dr. Buby for his help with drafting this presentation. Got questions? Email me at sydneyfaithbates1999@gmail.com. Thanks for listening.